So show of hands, how many people are sleepy? Show of hands. Excellent. Unanimous agreement. Good. All right. So we'll have something to talk about then, right? So I think that the topic here said, I think I told Valerie, help, I need some sleep. But I forgot the name of the topic, so I made up my own. Getting a good night's sleep, and we're going to explore some of the links between sleep, fibromyalgia, chronic fatigue, conditions involving pain. I treat quite a few patients with fibromyalgia and chronic fatigue in my practice. I know that virtually every patient with one of these conditions that I've spoken to is quite sophisticated from a medical standpoint. They've done a lot of reading. They've been on the internet. They know a lot. Sometimes they know more than I do. So I am honored to treat or to try to help patients with these syndromes, and I often learn a lot. And as a result, I kind of concocted this talk to be at not the sort of the baseline level, but kind of a little higher, okay, up. So I'm making some presumptions here. So this is going to be very relaxed, and if anybody wants to open questions, just shoot your hand up. We'll try to just work it into the framework of the talk within the time limits that we have. So if you don't know something, there's never a bad question. If you don't know something, there is likely to be somebody else out there who also doesn't know. So it's just good to pause and to sort of rewind the tape a little bit and say, okay, this is what we're talking about, if we need that, okay? So let me see if I can make this work. I think this goes forward. Yeah. So we'll start with, I'm going to put it out to the audience. Why is sleep important? Any ideas? Yes.
Helps your body to rejuvenate.
Very good. Any other ideas?
It heals you. Recuperation.
Yeah. Recuperation, rejuvenation. What else? Well, fair enough. Yes?
So that you can assemble what's happened in the day?
So that you can assemble what's happened in the day. So thinking, right? Memory, cognition. Yeah.
Repair?
Repair, rejuvenation, healing, thinking. Right. So actually, those were the two main things that I wanted to bring up. It's necessary for optimal cognitive function and for memory. And there are some nice experiments that were done in medical students, of course, that show that if you decrease sleep by even a half an hour a day, within a couple of days you can measure the cognitive deficit. And it continues to decline over the course of several weeks until you hit a plateau. If you decrease sleep any more than by half an hour, you can measure the deficit the very next day. Of course, sleep is necessary for recovery from injury and also from daily wear and tear. And that's the rejuvenation, healing part, right? Okay, well, here's a question. Why do people fall asleep? Why? Brilliant. You guys are right on it. Because they are sleepy, right? They fall asleep because they're sleepy. Does that sound like I'm preaching to the obvious? Well, a little bit, but we don't really have to look much beyond that. And there's a little subtlety here, okay? Because sleep is a state of being that's common to all animals, right? And it's governed by a biological clock that all animals, including humans, have. And this biological clock's got some peculiar and rather interesting features, which we'll talk about a little bit, okay? Basically, being tired doesn't necessarily mean you're sleepy. Let's say you're a healthy 21-year-old and you just ran a marathon. The marathon was started at 8:30 in the morning and now it's noon. Are you going to be sleepy? No, probably not. You're exhausted. You're totally exhausted. You probably can't move a bone in your body without some pain or discomfort, but you're not sleepy, right? And yet there are people who will, I know people who, patients who come and see me who will come home from work and they're not particularly tired, but they sit down in front of a TV set and they're not tired, but they fall asleep immediately because their biological clock tells them it's time to fall asleep. So we need to make this distinction between being tired and being sleepy because they're kind of two different dimensions. Okay? So bear that in mind as we do this, go work our way through the talk. Tired doesn't necessarily equal sleepy, and sleepy doesn't necessarily equal tired. Okay? And moreover, this clock that I'm talking about is really robust in some people. You know, come hell or high water, it's 9 o'clock at night, boom, you're out. But for other people, it's not quite like that. For some people, the biological clock is quite delicate and finicky. Okay? And those are the people who often end up in my clinic. So let's talk a little bit about what sleepiness means in terms of the biological clock and how it occurs over the course of the day. This fuzzy line that you see here is kind of a population-based graph of how most people feel over the course of the day. If you gave them a questionnaire and said, "So, are you sleepy yet? Are you sleepy now?" Starting at sometime in the morning, you're not particularly tired, but usually around noontime, 1 o'clock, 2 o'clock, you start to hit that afternoon doldrums that many of us have experienced, and that many of us are experiencing at this moment, right? And then there's a usual kind of pick-me-up period, sort of around the dinner hour and a little after, where you get your juices flowing again and you're good to go for a while. And then you get a more significant rise in sleepiness that begins usually around 9 o'clock for most people, and it begins to rise until 10:30 or 11, at which time, for most people, sleep is fairly imminent, and you're really needing to go to bed. Okay. Now, if you go beyond that time, you can actually achieve kind of a second wind, and some people will tell you that they kind of get a second wind. So this graph isn't exactly perfectly accurate because you can kind of recharge your batteries a little bit. But, and of course, it doesn't necessarily apply to everybody because some of us are night owls, aren't they? Right? Show of hands, who's a night owl in here? So about a third of people. Show of hands, who's a morning lark? Again, about a third of people. And then the rest of the people we're going to presume are somewhere in between, right? Yeah, there. We'll come back to that. So in fact, the population has a distribution of morning larks, kind of middle of the road people, and night owls, right? And so these curves are shifted to the right or to the left, depending upon who you are, to a certain extent, if they're robust. But if they're finicky, or if you're not doing so well, if you're sleepy all the time, then the curves may be flattened out a little bit, and you may be more tired during certain parts of the day. Guys, with me so far? Excellent. Okay. In fact, bear with me through these graphs. These are what we call hypnograms, or they're graphs of sleep stages during a typical night's sleep. The top one's for just a healthy adult, and the bottom one was actually for a senior, but it applies very well for a person with insomnia too. The numbers in the bottom, reading across the bottom, are hours of sleep. Okay, from the time that the lights are turned out to when you presumably wake up. And the numbers going up and down are the different stages of sleep. So at the very top, there's awake. And then down below, just for purposes of organization, they list REM sleep or dream sleep, rapid eye movement sleep. And then they go through the non-REM sleep stages, 1, 2, 3, and 4, where 1 is the shallowest. For most people, that feels like drowsiness. And 4 is where this just sort of deep punch-drunk type of sleep, where if you wake up, you don't, you're just confused and punch-drunk for a couple of hours. Okay. So those are the different stages of sleep. So you can see that the normal person takes a couple minutes to fall asleep and then gets into a very deep stage of sleep pretty much right away, and after an hour to an hour and a half, emerges back out to shallower sleep and into the first little piece of stage REM, and then they dive back down for a second cycle, and then a third cycle, and then usually a fourth cycle. Each cycle is terminated by a period of REM, and you'll notice that in each cycle the REM gets a little longer, okay? And that the really deep non-REM sleep gets a little shorter. So we stack our deep non-REM sleep toward the first half of the night, and we stack our stage REM or dream sleep toward the second half of the night. So that's an important thing to sort of bear in mind as we work through this.